Both C-pod and D-pod look very similar, and we'll do the similar work in these areas. They'll stay open 24 hours a day. They will have our emergency room physicians and nurses that are trained to take care of all acuity patients working in these areas. So I'm going to walk you through very specific things about D-pod that are a little bit different. Someone mentioned up front about our behavioral health patient population. That's a vulnerable patient population for us in this community and in fact all over the nation. So as they built this department, they really thought a lot about how do we keep those patients safe and how do we keep our staff safe. So here there are 4 dedicated behavioral health rooms for patients to come into. They have as much ligature resistant and ligature free devices in them for us to care for those patients whenever they come in to keep them safe. So that's unique in this area and definitely a benefit to our patients in the community. We're going to walk down this area, but I'm just going to describe kind of what you see. Each area has these nurses stations that are just kind of what you think, our secretaries. The admitting physicians will come down and see patients from these areas, and we'll work here. And then each area has its own unique set of things. This helps us with our staff doesn't have to travel as far to get to items. There's physician dictation stations in each area, a nurses station in each area. They made these nurses stations without desks because now we work on rolling computers all over the place, so the nurses can actually wheel in their computers, plug them in, and then sit down in these areas to be more efficient and make sure they have safe use of the hallways and the space. Each area also has its own clean linen and supplies, and then its own nutrition and medication stations. One of the areas that Emily was referencing, she's very excited about the new opening, is our trauma and resuscitative rooms. So we have 5 of those dedicated rooms in this new space. These rooms will allow for all of our equipment to be stored in the locations where the patients are going to come. So rather than the resources having to be pulled to those patients wherever they may be in the department, all the resources are available in the rooms. We will have one room that's dedicated for pediatric and obstetric trauma so that we can have all of that equipment located there. These rooms will have everything. They have computers in them for the physicians to review x-rays and films for patients so that they don't have to leave the patient's bedside to do those things. So we're very excited about the resuscitative bays that we have here in the hospital.